Wait.
Oh God, this is weird.
Okay.
Pretend we're not here.
Okay.
Go.
All right, first I'm going to go ahead and check doctor's orders, make sure I actually have the right patient and I'm doing the right stupid thing. Don't mind my weird comments. And then I'm going to go ahead and gather up all of my equipment. Stethoscope, watch, pen light, tuning fork, blood pressure cuff, something for you to read, which will just be a second. We'll figure that out. That should go long. Tongue depressor, thank you, and a cotton ball, which I'm not going to use, but. And then we're going to go ahead and I'm going to introduce myself. Hi, I'm Kelsey. I'm going to be your nursing student for today. Could I see your ID band for me, please? And could you state your name and date of birth?
Mary Mockmas, 5194.
There we go, and those are 2 identifiers. And then I'm going to go ahead and perform hand hygiene, so we're good there. And then provide some privacy. All right. Am I doing good so far with that? All right, sweet. And then I'm going to go ahead and start with the general assessment. Mary, I'm just going to go ahead and do a full head to toe, and I'm going to start with just a general assessment.
Okay.
I'm noticing you're dressed comfortably, but you're dressed appropriately for the weather. I'm not noticing you look well groomed, clean, your hair is nice and clean. I'm not noticing any dirt or smut or anything. Your hands look clean, you got shoes on, good to go. Also noting how you're sitting, you look comfortable, you don't look like you have kyphosis, scoliosis, lordosis, tripod position, you look pretty comfortable and good. Not even air hungry. Yeah. And then also going to assess your alert and orientation. Could you tell me who you are?
Mary Mockmas.
Can you tell me where you are?
The PT room.
All right. Can you tell me what time it is?
9:30.
And can you tell me why you're here?
Well, physical assessment.
Well, okay.
For physical assessment.
You know, I need to get the voices out of my head. No, for physical assessment.
Oh, crazy.
All right. So you are alert and orient ×4, so you're good there. We're going to go ahead and go into vitals. I'm just going to go ahead and take your blood pressure. All right, blood pressure, 120/80, perfect. Anything lower than 120/80 is good. We're going to go ahead and get your pulse. All right, between 60 and 100 beats per minute, we're good. Your respirations, but I'm not going to tell you that. All right, 12 to 20 breaths per minute, we're good. Temperature, 98.6 is normal, 96 to 99 degrees Fahrenheit is the range. And then pain. On a 0 to 10 scale, with 10 being the worst possible pain, can you rate any pain you have?
I have 0 pain.
All right, and we're good. And the reason why we use a numeric scale is just the most commonly used one. Everyone understands it. It's the most easily accessible.
Okay.
All right, and we go from vitals to upper extremities. Could you just roll up your sleeves real quick for me, please? Thank you very much. I'm just noting your skin characteristics and the temperature. Your skin looks nice, warm, and dry. I'm just noting your nails condition. They're smooth, they're not cracked or splintered. Nail cap refill is under 2 seconds. And could you put your fingers together like this for me, please? All right, I see a diamond, so that's a negative Shamrock's test, no clubbing, so you have good circulation. And just your brachial and radial pulses, bilaterally checking them for rate and amplitude. Nice and strong, good and healthy. All right, moving on. For extremities to head and face. Right, head and face, yeah. Pardon my reach. I'm just going to be feeling for your scalp real quick. And I'm just noting if there's any bumps, any lesions. Looking at hair distribution, nice good hair distribution. Do you color your hair? You do color your hair, so this is your natural hair color, I'm assuming, is a darker brown. Okay, I'm just noting, I'm just feeling for lymph nodes here, post and preocular, occipital, submandibular, submental, and I'm not feeling any lymph nodes, so I think you're good there. It's going to be assessing frontal and maxillary sinuses. I did move that around, just letting you guys know, because I feel if you're going to be assessing the face, you're going to be there, you may as well do it. That's just how I do it. And any pain there or any tenderness? Good to go? Okay. Face. And now I'm going to be assessing cranial nerve number 7. I don't know the names, I just know the numbers. And could you smile for me, please? All right, could you puff out your cheeks? And we're noting face symmetry. You're good to go. And we're just noting face symmetry, making sure there's no drooping or one side is, slower than the other. Everything looks good and even and quick. And then also temporal mandibular joint. Could you open and close your mouth for me, please? Yeah, alrighty. And now that's cranial nerve number 5. We're noting how the jaw is aligned and how easily it opens. I didn't notice any popping, cracking. Was there any pain when you opened it and closed it? All right, that's good. And no slipping either, so I think you don't have any TMJ. All right, moving on from that to, did I get everything on that one?
Mm-hmm.
Awesome sauce. All right. Head and face to neck. Eyes. Bah! Assess your vision. Gonna start with cranial nerve number 2, have you read something.
Okay.
That would probably be D. Yeah, could you go ahead and just read something aloud for me, please?
Maryville University School of Nursing Skills Checklist.
All right, and we're just noting she wasn't accommodating, she wasn't trying to bring it up closer or farther away. And we're also noting speech. She's clear. She's I can understand what she's saying. She's not mumbling anything, and what she's saying does make sense. So that was cranial nerve number 2. Now we're gonna assess cranial nerve number 3, which is pupillary response. All right, I'm just gonna go ahead and shine this light and just checking your pupils. Just keep your eyes open. All right, I'm assessing for PERLA, which is pupils equal round reactive to light and accommodation. Your pupils are equal round reactive and to light and accommodation, so you are good. And now, what do you think? Your pupils are gonna fail?
No.
How are we doing? Doing good. I'm on vision right now, just assessing the 6 cardinal fields,
Okay.
which is cranial nerves 3, 4, and 6.
Perfect. And what are you looking for with the 6 fields?
Extraocular movements.
Like, give me an example.
Like twitching, eye drooping, and
So use ptosis
ptosis
or nystagmus.
nystagmus. Okay.
Those 2 words are good. I mean, that covers you.
Ptosis and nystagmus. Sounds good. All right. So the 6 cardinal fields is when.
Hi.
Yeah, I got the thing.
Me too.
And an extra little tidbit note. All right. So you're just gonna follow my finger. All right. 1, 2, 3, 4, 5, and 6. All right. And I didn't notice any ptosis or nystagmus, so we're good there. And then we're going to go ahead and go into ears. And I'm going to go ahead and perform the Renee test. So I'm going to go ahead and strike the tuning fork, and I'm going to place it just right behind your ear. You're going to tell me when you don't hear anymore. I'm going to place it in front of your ear, and then you tell me when you don't hear anymore, okay? Oop, you're here. Pardon me. Sorry.
You're fine.
Oh, I know.
You can't touch the.
Yeah, I'm hitting the wrong spot.
I don't hear it anymore.
Still hearing it? All right. Well,
I can't hear it anymore.
well, that's good, because as long as bone conduction is heard less than air conduction, you have good hearing. And I would be doing that for both ears.
Okay.
That's ears. That was assessing cranial nerve number 8. And then we are going to go into nose. Assessing the skin characteristics, looking at your mucosa, your septum. You know what? It looks like your septum is not deviated, your mucosa is not red or swollen, nice and healthy and pink. And I'm going to be assessing ocular cranial nerve number 1 with a scent. Figure something out. But yeah, there we go. Pardon me. Oh yeah, over here.
Making her smell chemicals. Good choice.
Oh yeah. Man, we're breathing it all the time. Okay, I'm just gonna have you close your eyes and just close one nostril for me, please. And could you tell me what the scent is? Wafting this big ass thing in front of you. Could you just go ahead and include your other nostril for me, please? you smell it?
Yeah.
All right, we're good.
Smells clean on that side too.
And just noting that she sells it equally on both sides. And since there's no swelling or rhinorrhea or anything, she should be able to smell it just fine. If she doesn't, then there might be something neurologically wrong, but she's good. All right, nose, mouth, I'd be putting on gloves. And then, so 11 up. And if you could just open up your mouth for me, please. And I'm just noting, don't mind me, I'm just noting oral mucosa, making sure it's good and healthy. Your teeth, could you smile? Noting, do you have all your teeth or have you had any removed?
I have my wisdom teeth taken out.
Okay, you had your wisdom teeth, any other teeth taken out? Okay. Noting that your teeth are nice and healthy. I'm not noticing any brown or black spots, nothing loose. You said that all your wisdom teeth are missing. Looks like all your adult teeth are good and healthy. And I'm going to go ahead and assess cranial nerve 9 and 10. Oh, yay, sense. Thank you. Look at that. Cardamom and clove. Who the hell knows what that says? Anyway.
Not a good one.
Cardamom. That's so terrible. All right, if you could just open up your mouth and say "ah" for me, please. All right, I'm noting her uvula, making sure it's midline, and when she says "ah," making sure that her uvula and her palate move up evenly with each other. Nothing's deviated. Nothing's not out of order. You don't have a double uvula. No, it's called. But
Do you not need the tongue depressor for that? To check her?
honestly, I could see it just fine. But I guess if you can't, you can use the tongue depressor. I personally don't like to use the tongue depressor because I hate it. It makes me gag because I have a terrible gag reflex, and I'm like, just for the safety of the comfort for the patient, I don't use it. That's just my personal thing. But, and then, yes, and that was everything for the mouth.
Mm-mm.
Yeah, for the mouth. And now
You didn't do tongue.
Oh yeah,
Strength.
cranial nerve number 12. Could you stick out your tongue for me, please? All right. I'm also assessing tongue strength. Could you just to the side? All right. Okay, you can go ahead and put it back in. I'm just noting tongue strength, making sure it's not deviated to one side or another. If it is deviated to one side or another, that's a big indicator of something seriously wrong, like a stroke. So you would really want to report that. But it looks good. You look like you have it. It's nice and strong. It's healthy and pink. No lesions on the sides. You're good and healthy. Then the neck. Right, we're going into the neck now.
Mm-hmm.
All right.
Your gloves are off, right?
Hmm?
Your gloves are off, right?
As soon as she sees us turn the camera on her, she runs
Yep.
away.
Leave one at the door then. All right, just noting midline, everything. Your clavicular lymph nodes. I forgot what these lymph nodes are called, but these lymph nodes. And then,
Is it chain of lymph
yeah, it's like a chain of lymph nodes all down along both sides of the neck. And then, yeah, that's cranial nerve 11. Could you turn your head side to side and turn your shoulders for me, please? Thank you. And we're just noting the strength of her shoulders and being able to fully turn her head side to side. Everything looks good and strong. And you're able to do it smoothly, so everything's good there. And then cranial nerve number 10. Going to palpate the trachea and make sure it's good. And midline, could you swallow for me, please? Thank you. But with cranial nerve number 10 was swallowing. Everything moved down smoothly. Her trachea moved up nice and evenly. No problems there. And then I would go ahead and go into neck. And posteriorly your thorax. Correct?
Mm-hmm.
Sweet. All right. Yep. So, noting, I'm not going to make you take off your hoodie, but just in general, make sure the shoulders and scapula are even. Noting skin characteristics, if there's any lesions, any bumps, lumps, anything weird like that. any acne. Just palpate for tenderness, and at T10, could you take a big breath for me, please? All right, chest expansion is good. She has a 1-to-2 chest ratio, and then auscultating at the 6. I was going to ask her about that today, so to be honest,
She said it doesn't matter. It's just 6.
Oh, okay, just do $6. All right. This is weird. All right, everybody. Y'all good? Looks like I'm doing this on a random person. Okay, so it'd be like the apices, and then you probably want the base. And then you're just making sure that the lung sound, that the sounds are clear, there's no crackling, rhonchi, wheezing, anything adventitious or weird. And everything sounded good and healthy, so you're good there. Now we're going to go, hi. And accessory muscle use, she's sitting nice and relaxed. I'm not noticing her chest or neck really moving up, so you're good there.
Are you doing interior?
Yeah, interior. So same thing, noting skin characteristics, noting any accessory muscle use, palpating for tenderness, and the 6. Auscultating 6 spots. So I would probably start up at the apex, pardon my touch. Belly. Go down, like right here. And just make sure you get the apex, the middle, and the base of the lungs is what I'm going to be doing. Alright, that's everything for the lungs, and now cardiovascular. Alright,
This is not as bad as I thought it would be.
No, it's not bad at all, honestly. Like, you just...
So
And the only reason why I'm missing things is because it's the morning.
Mhm. You've only missed 2 things, so you're good.
Keep going.
Keep going. We're trying to do it in 30 minutes.
Alright, could you lay down for me,
17.
please? I'm going to be doing cardiovascular assessment.
Vital signs.
Alright. And could you just turn your head to the side for me, please? And I would have the head raised
She's had
30
a
degrees.
run to get stuff. Sarah's coming in talking. Thanks for your butt in my video.
And I'm just noting jugular venous dissection, making sure the pulse, nothing's distended, pulse is low, you're good and healthy. Okay, just go ahead and lean back for me, please. Wait, now I see what I did. You said I don't want to be in here.
Nope.
Alright, I'm also going to go ahead and palpate your chest real quick, so just pardon my reach, but I'm going to be palpating the apex, the left sternal border, and the base of your heart, noting any weird pulsations, thrills, everything feels good. And then I'm going to be auscultating for the aortic. I'm just going by general pulmonic, herbs, tricuspid, mitral. Oh, and your carotids, palpating them, making sure they're good and strong, and then auscultating for bruits, so you're good there. And then abdomen, go to the patient's right side, checking. And then with the abdomen, we're just checking skin characteristics, contour, make sure the umbilicus is midline.
It's beautiful gray color skin right there.
I know, right? It's like a cadaver.
Oh,
Winter skin.
it's winter skin.
Oh, jeez. It's early. And then noting any abnormal pulsations. We're all good there. We're going to auscultate in all 4 quadrants for 5 to 15 seconds. So, I know it's not the 15 seconds. I don't rightly care at the moment. And then auscultated, hypo, hyper, absent, whatever you hear. And then percuss. Pardon my touch. I'm just noting if it's resonance, dullness, timpani, all that fun jazz. I hear you. And then palpate for tenderness. Are you good?
No tenderness.
No tenderness, just hungry. And then abdomen into
You're at
lower.
the 20-minute mark, just so you know.
20-minute mark? Oh, I'm doing
And
pretty
you
good.
didn't even do vital signs, FYI.
Do the best in the beginning.
Well, she didn't
Yeah,
do,
the
like,
very
blood
you
pressure.
didn't do the
and-
whole timing of it.
Right, yeah, it's true.
Did you do
So-
10 minutes? You're fine. You only
Yeah,
Good for
right.
you know.
Lower extremities.
Probably like 2 minutes or so.
Yeah, honestly,
30
I
seconds.
plan on getting it in within the first try.
Are they checking our blood
Well, we
pressure?
all have all these
Yeah.
we had all
Yeah.
these interruptions anyway, so it doesn't.
Yeah.
Right. So skin characteristics, same thing. We're just noting.
I'm gray.
Yes, she's dead. She's dead, Jim. But skin characteristics, temperature, good hair distribution, then
Or no hair distribution.
or no hair distribution.
Mm-hmm.
And there is hair distribution.
It's okay. And then dorsalis pedis, posterior tibial, popliteal, and femoral. And then just feeling for those, amplitude, rhythm, and then musculoskeletal, neurological. Or you can go ahead and sit up now. Are you experiencing any tingliness or numbing in your extremities, in your arms or legs or anything?
Not at the moment.
All right. Are you experiencing any weakness in your arms or legs?
Not at the moment.
Okay. Sounds good. And could you just, and then the same thing with your legs, so if you could just scoot down a little bit and then just flex and extend. All right. All right, and could you, all right, everything, passive and active flexion extension of your extremities. Everything was good, everything was smooth, everything was strong, and I didn't notice any crepitus or weakness, so good there. Could you stand up for me, please? I'm going to be assessing your back, so go ahead and just lean forward for me, please.
Sure.
And no scoliosis, you're good. And then could you walk to the trash can with the ball and then walk back for me, please? I'm assessing gait.
I'm making sure she's not drunk. Just kidding.
Oh, someone had a morning cocktail. All right. And then I'd wash my hands and document. Woo!
Yay!
Somebody sent me that.